Hi, welcome to another episode of Bite Size Health with Sara. I'm Linda. This is Sara. And we are going to cover some questions today that those of you that have been emailing a while back had sent in. So we'll try to cover some of those. But before we get started, this is just a reminder that we are doing this for informational purposes only. Although Sara is a health coach, she's probably not your health coach. But if you want her to be your health coach, or at least explore that possibility, you can go to her website, healthwithsara.com, and sign up for a consult. And she will also be starting a newsletter in about July. So you'll be able to sign up for a newsletter as well, where it will expand on some of the topics that we cover. All right, the first question is from Jim. What are the symptoms of a leaky gut, and are there any tests on the market to help identify it?
Oh, good question, Jim. So leaky gut, it has the obvious symptoms of GI distress, such as bloating, constipation, diarrhea, or it could have the less obvious signs, such as fatigue, joint ache, skin issues such as eczema, acne, depression, brain fog. So there's a lot of inflammation. There's a lot that could happen. So if you can't find out, if you're doing everything that you can for your skin issues or your brain fog and you can't get to the root cause, always explore your gut. Make sure that your gut is in a balanced state. So there are tests on the market that can measure your zonulin level. Now, zonulin is the protein that regulates the tight junction of the intestine. So it can...
Is that what keeps it sealed tight?
Exactly.
So it doesn't have any openings?
Exactly.
Okay.
Exactly. So it's a blood test or stool test, and there are also tests that checks the antibodies to zonulin. However, those tests are not clinically validated because sometimes you can start feeling better, but the test still shows high levels. So I would say when it comes to leaky gut, just trust your symptoms. If your symptoms are getting better, your leaky gut is getting better. However, there are tests that I really like that I order that checks your microbiome. There are a lot of different companies on the market that do that. My favorite is the Biome FX with Microbiome Labs that can measure your good bacteria, bad bacteria, keystone species. So that's the test that I like.
Okay. So with the leaky gut then, that's something that can go like throughout your body because it's traveling in your bloodstream.
Absolutely, yeah.
Okay.
So sadly, unlike Vegas, whatever happens in your gut doesn't stay in your gut.
I like that. It's a very good way of putting it. Okay. So Cheryl asks, what is the role of our gut biome in supporting our immune system?
Huge. Our gut microbiome has a huge fundamental role in regulating our immunity. We've touched on this before. Over 60% of our immune system is housed in our gut. So when our immune system and our gut microbiome work together optimally, it's like a shield against any pathogens, like a barrier that the pathogens can get inside. However, with the overuse of antibiotics, our SAD diet, the standard American diet, lack of sleep, too much stress, not enough fermented food, all those things have contributed to this relationship being broken, and it has increased the autoimmune disorders that we see like hugely, and cancer and all that. I'm sure you see that in the practice as well.
Yes.
So
yeah, we do.
Yeah, so it plays a huge role. If you want to have a good overall health, the first thing to address, it's always your gut. Everything starts in the gut and it goes out from there.
Okay. Okay. And that's a good thing to know because I think we're so given to saying, like, I've got IBS and that I've got to cure it there. I'm not backing further up to say, is it the food I eat? Is it the environment I live in? Is it, any of these other things? It's more like, is there medicine I need to take to fix this?
I think as a society, we're used to quick fixes.
Yeah.
But we need to put the work in because if you fix your gut, you may have like 5 or 10 issues that are completely unrelated, and you see different doctors for every different issues. Like you've got diabetes, you've got high cholesterol, you're dealing with obesity. You're seeing all these different doctors, and they're all giving you medication for different things. But if you put the work in and do the work from inside, it will go outside. So everything goes back to gut. I'm a huge believer in that. I've seen the effects of that. So to me, gut is one of the most important, actually the most important thing when it comes to health, and addressing it, I think, should be on top of everybody's list.
And not even just the immune system, because I know, like, we think of making sure that our doctors all talk to each other, but then you have somebody that's got anxiety or depression, and they're seeing a psychiatrist or a psychologist or a therapist, and you don't ever think of sending that information back to all of your other doctors, yet we're discovering that the gut also supports that.
I think that goes to how we were trained as a society, and also our doctors. Like, we look at the body, not something that everything works together, but we look at things that everything has its own separate doctors, but everything in reality, everything is related. So when something doesn't work, the chances are it's going to affect something else.
Yeah.
Yeah.
Well, and that makes perfect sense, especially the more we learn.
Absolutely.
So, question number 3. Sally wants to know, Sara, if you can touch on IBS and SIBO and talk about the difference and similarities between those two illnesses.
Okay. So for those of you who don't know, IBS stands for irritable bowel syndrome. There's really not a test to diagnose IBS. So when you see your doctor, they usually order a lot of tests to eliminate every other possibility. And when
like Crohn's or colitis or something like that.
Yeah, and when everything is negative, then they usually diagnose it as IBS. So IBS, most of the patients usually have diarrhea and bloating and pain, but IBS patients can actually be constipated, or they can have diarrhea for weeks and then be okay, and then again diarrhea. So there are 2 types of IBS, IBS-C and IBS-D, which stands for...
I did not know that.
So IBS-C stands for constipation, and D stands for diarrhea.
Okay.
I think it's the most common form of GI disorder, and there is a huge relationship between your gut brain. So if you're stressed out, you're probably more prone to IBS, or if you have IBS, you probably have symptoms of anxiety and all that. So there is that connection as well. Now, IBS has been around forever, so it's not a new diagnosis. SIBO is small intestine bacterial overgrowth. That's a newer diagnosis. The first time that I heard the term SIBO in a conventional setting, I think it was about 4 or 5 years ago. But SIBO's been around for a while, for about, there's been studies on it dating back to 15, 16 years ago. So with SIBO, it's how you diagnose SIBO. There is a test. There is a breath test that you can actually diagnose SIBO. Now, not all the insurance companies do pay for it, but some do, and you can always pay out of pocket. The symptoms of SIBO is usually bloating. That's a huge symptom. And diarrhea Also, it could have constipation as well. So how SIBO happens, it's when you have bacterial overgrowth in your small intestine. You're not supposed to have a lot of bacteria in your small intestine, if any. So when you get overgrowth in that area, you have bloating, you have a lot of issues. That's when, and what causes SIBO, it's the motility. Like if you have one of the causes, there are other causes, but the main cause is slow motility.
So things hang out too long in the small intestine.
Yes.
Okay.
So you know how there is the migrating motor complex, the housekeeping, that like after you eat, they come and they brush your intestine and the food and the bacteria and everything gets pushed down. So if that's not working well, if you have slow motility because of that system is not working well, the food does not get digested, and the bacteria, the bacteria can start, you have an overgrowth of the bacteria start eating the food and they start producing gas, and that's why you get the bloating and the fermentation where it shouldn't happen.
Okay.
Now, with the migrating motor complex, what causes that? SIBO has a lot of things can cause SIBO, but the main thing that causes SIBO is actually food poisoning. It's either food poisoning or stomach bug or something like that. And how the mechanism works, it's really interesting. It's food poisoning, it can be bacterial or viral. So, but when it's bacterial food poisoning, the bacteria, the toxin that they release almost looks like the protein in the nerves of your small intestine. So when your body is responding to that toxin, kind of an autoimmunity deal happens. It cannot tell the protein.
It's confused.
Yeah, from the toxin. So it starts destroying the protein as well. And then they can't make the motor migrating complexes, so that's how the motility slows down. Now with SIBO, you may you may get food poisoning, and then you will be okay. So you won't have SIBO right away. It may take a month or 2 months or 3 months.
Which makes it hard to tie it back to what the actual cause is.
Exactly.
Okay.
And then you end up with bloating and diarrhea and constipation. And you're like, what? Where did this come from? And then you realize, if you go back, you're like, oh, it was the food poisoning. So most patients that have IBS, studies show that they have SIBO. SIBO can cause IBS. So it's best to take care of SIBO, right away. There are different diets, and maybe we can just do a session on SIBO later on, because it's fascinating and it's getting diagnosed more and more often. So,
and this is the small intestine, whereas IBS is going to be the colon and the large intestine.
Absolutely.
So they will connect to each other.
Absolutely.
Okay. So one feeds the other.
Exactly. It all starts in the gut and stays.
Yep.
Not a good situation.
No, it does not sound like it. And our fourth question is from Linda. What's the best diet for a youthful gut? Now, this is not me, Linda, but this Linda also wants to know for obvious reasons.
Yes.
How do I keep my gut young?
Yes. So yeah, that's a good question. So we've discussed this before, that different diets work for different people. So that works for me may not necessarily work for you. But when it comes to the gut, there are certain things, all the diets have certain things in common. And I know it doesn't sound sexy at all, but fiber. So we just need to increase our fiber intake, because that helps feed the probiotics, the bacteria. So you need to take a lot of fiber, a lot of colorful foods, like anything that has colors, like blueberries and strawberries. If you don't have any allergies, tomatoes and green pepper, anything that's colorful, because they have substances called polyphenols that are really good and healing for the gut. So spices, turmeric, cumin, any spices, teas like green tea, black tea, those are good. Good fats like avocado oil, olive oil, those are some of the things that are good for the gut. Also fermented food, that's something that
That's on my favorite list.
absolutely, yeah, we always talk about it. We both love fermented foods.
Yeah.
And you make it too yourself.
I'm working on it. Yeah.
Yeah.
Yes, and some I buy.
Yeah.
So
yeah, that's great. So fermented food. So the things that I would say to focus on is fiber, your fiber intake, diversity of the colors that you're eating. So try to eat the rainbow, and then also fermented food. Those are the things that probably would help your gut, your microbiome, because it's all about diversity of your microbiome. So the more color you eat, the more food you feed them. And then focusing on prebiotics, so fruits and vegetables and green bananas and artichokes and things like that.
okay.
So, yeah.
Okay. Well, I know, and one of the other questions that you've gotten so much of in one form or another is probiotics and prebiotics, and taking them as a supplement or getting them through your food, and what the difference is and how that supports your system, which I know we don't really have enough time to cover that today. So
Yeah.
I think maybe the next session will be strictly on the
Yeah.
probiotics and the prebiotics.
Yeah.
And
Yeah.
we can look at that, pills versus eating the food.
That sounds good. Yeah. Let's do that next time.
Okay. And so this concludes another session of Bite Size Health with Sara, and we hope to see you the next time. And again, if you're interested in having a consult with Sara, you can visit her website of healthwithsara.com. And we hope you guys have a great day, and we'll see you next time.
Bye, guys.
Bye.